This webinar is timely as increasingly limited resources must be leveraged to maximize ITN coverage through various distribution channels. Funding constraints will limit mass campaigns, necessitating stakeholders to make the most of every dollar by optimizing and utilizing a robust set of appropriate continuous distribution channels. And today we'll hear two fantastic presentations that cover different aspects of continuous distribution, both which emphasize tools developed to help malaria programs and their partners plan for, execute, and track continuous distribution efforts. So here's the webinar outline. I'll very quickly give a one-slide introduction of the RBM Vector Control Working Group structure to contextualize this webinar. The body of the webinar consists of two presentations. The first is a 1-hour presentation, which will include question and answers, and we have a little bit of time. We can even go past that. The second is a recording, which will last about a half an hour plus including question and answer. So the recording is about 17 minutes, and there'll be time for robust conversation after it. So our first presentation covers recent updates from the Alliance for Malaria Prevention's Continuous Distribution Toolkit, with a focus on school-based distribution. Presenters will share updated step-by-step strategies and adaptable tools developed with the ANP CDWG Continuous Distribution Working Group to support school-based distributions and enhance continuous distribution efforts overall. And our panelists will also share perspectives for future ITN continuous distribution resources in progress through the ANP Continuous Distribution Working Group. So this great work will be presented by members of the ANP Continuous Distribution Working Group, namely Kedi Ndlovu Sichalwe from Zambia NMEP, Mary Conte from Eau Claire Consulting, Stephen Poyer from Tropical Health, and Prince Owusu from Population Services International. The second presentation focuses on tracking continuous distribution implementation in a rapidly changing landscape. So Sophia Kaufman from CHI's Vector Control and Prevention team has recorded a presentation on a newly developed ITN Continuous Distribution Tracker tool, which helps monitor progress, identify gaps, and support implementation across ITN delivery channels. So here's an updated RBM Vector Control Working Group structure. And just as a refresher, RBM Vector Control Working Group has 3 key objectives. First, to align RBM partners on best practices to reach and maintain universal coverage with effective vector control interventions. Second, to support the implementation of vector control guidance generated by WHO and to galvanize efforts towards achieving specific country and global malaria elimination targets. And finally, to convene, coordinate, and facilitate communication between the diverse membership of working group members, including national programs, product manufacturers, academia, implementers, policymakers, multilaterals, and civil society organizations. So this presentation is situated within Workstream 1, called Enhancing the Impact of Core Interventions, and more specifically, within Task Team 2, using non-biological data to address threats and inform decision-making. We wanted to flash this on the screen just so mentally you could kind of contextualize where the presentation is coming from. So those are my introductory slides, and without any further ado, I'll hand it over to Kedi. Thanks so much.
Thank you so much, Keith. Good afternoon, good morning, everyone. I'm so excited to be here. So my name is Kate Ndlovu Sichalwe, and I will be co-presenting with Prince Mary, Stephen, and Prince Mary and Stephen. So I will take you through the Continuous Distribution Toolkit. So this is basically an update from the work that the MP Continuous Distribution Working Group has been doing. Next. So next slide, please. So despite the many challenges that we have, especially in increasing global funding uncertainties, it is very important that ITNs are optimally deployed to reach all the people in need. And it's also very critical that we strengthen ITN distribution, including continuous distribution that provides important options to consider for improving ITN and sustaining ITN access. Next slide. So what then is continuous distribution? So just to inform you that when we talk about continuous distribution, it includes quite a number of channels. This includes routine healthcare services such as antenatal care and expanded program for immunization. It also includes school-based channels and community-based channels. Next. Just a few channel descriptions there. When we talk about routine distribution, we're referring to distribution through ANC and EPI. And with this channel, we directly provides ITNs to pregnant women and young children who are biologically vulnerable in malaria endemic settings. When we talk about community-based distribution, so this is the distribution of ITNs to households with ITN gaps based on criteria established by the NMEP. So there's been various national malaria programs that have done community-based distribution. And one example would be where we identify a community holder within the community and also identify community hubs. And the idea is to provide nets to the households as and when they are required. You don't necessarily have to wait for a campaign. So it's where you're distributing nets on a continuous basis, and the criteria is basically determined by the National Malaria Program working closely with the communities. When we talk about school-based distribution, we're actually referring to distribution of nets to targeted specific classes. It can be in primary schools or secondary schools, but then there are quite a number of criteria that is targeted, but this is done annually and also helps to provide sustained ITN access to households. So when it's school distribution, the idea is to improve ITN coverage and access at a household level, and the pupils, or rather the school, is being used as one of the channels to deliver nets to the households. Next slide, please. So we will take you through the toolkit just to give a purpose and the rationale for this toolkit. So the ITN-CD toolkit provides operational guidance, and this focuses on key activities, resources, and some country examples and tools that are designed to implement ITN continuous distribution programs. And also the toolkit is designed for NMEPs and the technical assistance partners and stakeholders in supporting ITN distribution. You will notice that the toolkit also takes a step-by-step approach through decision-making, coordination, implementation of ITN via continuous distribution channel. Next slide. So for today, this is just how the presentation structure looks like. I will take you through the AMP channel selection guidance. Thereafter, Mary and Stephen will take us through the MPCD toolkit with a focus on school-based distribution toolkit. And they'll also take us through guidance on ITN distribution through routine health services. We will have a question and answer section where Prince will take us through, but as the presentation is ongoing, please, we encourage that you can already start putting in your questions in the chat so that they can be tackled at the end of the session. Next slide, please. So just to mention that we have the AMP channel selection guidance. This can be accessed through the AMP website. And the guidance, next slide. The guidance will just take us through some of the key considerations that we need to take in place of the planning parameters as we plan for the various continuous distribution channels. So when we're looking at selecting channels to address the emerging gaps, especially when we look at the current funding context, it is crucial to adopt strategic and adaptable approach. And it is also very important that ITN should continue to be selected according to the insecticide resistance profiles. This is data that is generated by the NMEPs. And we're also encouraged, in line with the use of data for decision-making, also at subnational levels, to explore optimal channel mixes to ensure sustained ITN access. One thing that is critical, that in selection of both ITN type, and the optimal mix of ITN channels, we need to maximize the impact. So as we go through this process, I hope this is going to be very helpful in our planning. Next slide. In our planning and also in our implementation in the current funding landscape. So when we talk about the channel selection, the main objective is to provide NMEPs and partners to assess the existing channel capacity, its effectiveness and efficiency in reaching and maintaining equitable access in the targeted populations. So it is not a one size fits all. So it's very important that data is used to make decisions. And the second objective is also to understand the strengths and limitations of each channel and distribution strategy. So we'll look at different channels. So it is very critical that we understand its strengths and limitations. And we also want to determine the optimal ITN distribution channel mix based on data and the local context. So there's a lot of guidance that is available on the AMP website. I'm sure as we go through the session, we will, Steve and Mary will take us through that. Next slide. So as we are planning for distribution of nets through the various channels, so when we talk the current distribution channels that we're looking at is the routine distribution through ANC and EPI, the school-based distribution and community distribution. There is a guidance document that has been developed through the AMP, and there are key considerations and recommendations that have been drafted to guide national malaria programs as we look at, as we plan for distribution through these various channels. Some of the key considerations that we should look at is access, target population, the quantification, the epidemiological data, operational considerations. So to begin with, there's a few that have been put there just for us to look through and discuss, and we should be able to get into the details as we go on. So when we talk about access for under routine distribution, it is critical that it is critical that there's continuous flow of ITNs into the targeted households. So with regards to ITN distribution through ANC and EPI, even in a mass campaign year, it is important that nets still go to the vulnerable population in our context. And also it is critical that as we are looking at access, we also try and maximize the reach, and also that we use channels to leverage existing channels such as NCPI. So there are other ways that we can distribute nets to the vulnerable population. So as we look at the pregnant mothers and under ones, depending on the country's context, it is important to also expand to other target groups that can also be vulnerable. And in terms of access, I'll move to school-based distribution. So this should also be data-driven, and there should be equity access and also address any disparities. So when we look at school-based distribution, it is important to understand that this is a channel that is going to help us take nets out to the households, and we're also trying to increase access at household level. So as we are choosing the grades, because like I earlier mentioned, we target specific grades as we are doing school-based distribution. So we need to understand which grades will give us the highest impact, or where do we find the high attendance ratios. So we need to address some of the disparities that might come in as we are giving this to targeted grades. So when it comes to community-based distribution, it is important to understand the usefulness of maintaining continuous access. So with community, we're trying to provide nets to the communities as and when they are required. So this is also one of the channels that we can routinely give nets or at a continuous basis. So we look at access, we look at the target, the timing, we also have the quantification. As we are quantifying, we have a quantification site at the the MP website that provides country-specific quantifications, and there are also quantifiers that can be used as we are doing the quantifications. And this, as we're quantifying for all the channels, it is important that we use country-specific data, and we use scenarios that have been used probably in other programs, so that, and also that can be beneficial to our context. Next slide. So the other considerations that we can look at is the costs and also the operational and epidemiological consideration. So when we look at the costs, it is important to integrate some of these channels as we are doing the it is important to integrate with existing processes. I'll give an example of community-based distribution. If we have other community activities that we are doing, for instance, there are programs that are doing ICCM, integrated case management, how best can we integrate community-based distribution to ensure that as we're providing these channels, we get the optimal coverage out there. So also, as we are looking at the cost for these channels, it is critical when we look at school-based distribution, we look at community to take into considerations some of the factors in budgets like planning meetings, the training sessions, and also printing and registers for other educational flyers. So these are some of the considerations that we need to look at, but one thing that is recommended is to ensure that some of these things can be integrated into other existing systems that are already at play. And when we look at routine, there's a lot of shared costs when we look at routine distribution, because these are nets that are sent that are given to the beneficiaries on a routine basis. So we have the staff readily available, you have storage probably readily available at the facilities. So you will find that there's a lot of shared costs in routine distribution. And we also need to identify where the gaps are. And if at all, we need to also look at the transport costs. So transport costs here, we're also looking at the logistical part of the movement of nets from the central warehouse to the health facilities. We also need to understand the operational considerations when we look at some of these channels for distribution. We do understand that it is important that NMEPs review the ITN channels with stakeholders and try and integrate with other service areas like MCH, the mother and child health, and see how best the budgets and plans can be integrated to try and cut on costs as we are trying to budget for some of these channels in these resource constrained times. And when we come to the epidemiological consideration, it is important that we try and reach also the undeserved populations and also complement some of these channels between school and community and try and leverage on community networks like I had earlier mentioned. Next slide, please. So with that, I'll stop here and hand over to Steve and Mary to take us through the LMP ITN CD Toolkit with a focus on on school-based distribution considerations. Thank you. Over to you, Mary.
Great. Thank you so much, Ketty. And just wonderful working with you and Prince. And thank you for your leadership, both of you, for the CD Continuous Distribution Working Group and for the support for development of this ITN Continuous Distribution Toolkit. And many thanks also to VCWG Workstream 1 for organizing today's webinar. Excited to speak with everyone today. So the CD Toolkit is an ongoing initiative of the RBM, Alliance for Malaria Prevention, AMP, as Keith mentioned at the beginning, through this continuous distribution working group. And it's really been an effort that we started last year in bringing in broad inputs across partners, donors, and primarily national malaria programs and bringing in their experiences, and as well as incorporating tools and resources directly from countries. So it's great to be able to provide this overview of the toolkit and looking at the updated guidance, adaptable tools, and resources that we've been developing for continuous distribution. So next slide, please. So very happy to report that this initial phase of the continuous distribution toolkit is ready to go after a lot of inputs and a lot of feedback from all of you. So thanks everyone who provided inputs. And the website will go live, very exciting, next Thursday. And then there will be an official announcement planned for the MP Weekly Call on July 9th. So watch your inboxes. Please do join that AMP Weekly Call on July 9th to get additional information and the links to the live website following post-launch testing and any final last adjustments. But we were just wanting to include some screen grabs so you can kind of see what the new toolkit looks like. We'll have a landing page on the left-hand side with some background and overarching information, and we will have links to community distribution, which will come live later. That's not yet in development. And then the routine section we'll talk about, Steve and I will talk about next. And then the school-based distribution toolkit, which is where we started and we'll present more on today. And then that links then to the right-hand side and some key steps that we've outlined for each of the key steps for implementing school-based distribution. So we can take a closer look at that on the next slide. Great. So, and just noting that, this is not reinventing the wheel. Our work on this toolkit is really focused on reviewing previous AMP, PMI Vectorworks, VectorLink, and other work that's available on continuousdistribution.org and has been available to date there. And really looking at those available resources and any planning and implementation updates, and then pulling in the information that we have available from our own implementation, as well as working with national malaria programs, and pulling in more updated resources. Also trying to streamline, I think as we move forward, there's, previously we had a lot of sort of 100+ page narrative documents. So this is really, recognizing that in this, modern world that we don't have as much bandwidth for reading long narratives. So it's really meant and designed to be an interactive website where people can quickly get information, quickly see what's available, and that there are longer narratives and tools and things that people can dive into as they would like, but there's also streamlined versions. So the updates include this sort of streamlined, updated step-by-step structure that's outlined here, and I'll talk about more in a minute. It includes new tools and resources shared directly from national malaria programs with, really a huge shout out of thanks to the Zambia, Tanzania, and Ghana teams for sharing tools and resources. And we're always open to more. So really, again, thanks to VCWG for helping us to amplify and talk about this with others. So, please do reach out to any of us through Joanna if you don't directly have our email addresses, and we would love to include other information that you have that we won't already have in the current version. It will also link to the ITN campaign toolkit, which AMP is also updating. And we very much want to have an overarching, one-stop shop for anything related to ITN distribution on the website. So we'll have, different links that, will take you to different sections of the toolkit operationally. But, really recognizing that given the funding constraints that were mentioned at the start of the call and that we're all living through, that we need to bring a lot of innovation and really be thinking about how we can make those robust and dynamic channel selection decisions that Ketty mentioned. So we started with one second here, my little puppy Bella would like to join the call. We started with a focus on, she loves school-based distribution. So we started with a focus on school-based distribution because we needed to start somewhere, and it takes, quite a bit of legwork to pull this all together. And we also felt that it was, one of the channels that's one of the continuous channels alongside routine as the essential channel that we should all have in place is one of the most promising channels and most widely used channels. So we wanted to start there, but we will continue with routine, building out a routine section next, which Steve and I will talk about next, as well as then community-based distribution. So in the school-based, in the CD toolkit, there will be sections that we saw, those first three buttons that we saw on the site, which will present these, what we're calling upstream steps. So steps that cut across all channels, including coordination and channel selection, quantification, and waste management. And then we have what we're calling the downstream steps by channel. So, I'll give you a little snapshot of what it looks like for school-based distribution. And those will include steps for planning, logistics, supply chain management, training of personnel, SBC, implementation, and M&E reporting and digitalization for those sections. Next slide, please. And then just to give a sense of what one of the sections will look like. So I just selected step 5, logistics and supply chain management. And, some of the key considerations here. And I think it's noteworthy that logistics and supply chain for school-based distribution has, many similarities, and the logistics components of tendering for and contracting with transporters, for example, will look very similar across channels. So we will not be reinventing the wheel and having the exact same detailed information on logistics and supply chain in every single subset of the toolkit. We will have specific considerations that are specific to school-based distribution. So for example, SBD, as we call it, typically occurs once per year, and works through a process of identifying pupils enrolled or attending school in the selected class levels to, previously receive one ITN. Steve will talk about some innovations where, maybe we rethink that and give out more than one ITN to students if we're incurring the operational costs already for the channel. And then alongside this, Steve will talk in more depth about this, but we have developed a series of adaptable tools which are linked with the online toolkit, which provide further guidance and are in a downloadable Word or Excel format, where it walks through a series of prompts and a template to have a logistics and supply chain management plan for your school-based distribution. And that would be as part of an overall plan of action. So it would include, identifying transportation, storage, distribution points, what to do with any surplus ITNs after issuing, describing the process for, local procurement of any, specific, beyond the ITNs, any specific, tools, recording documents, any other types of services or non-ITN supplies. And then it will also include a logistics timeline, budget, tools, terms of reference, roles and responsibilities, reporting, and oversight. Next slide, please. So here we just wanted to provide a quick screen grab of what step 5 includes. This is just part of it. But it includes additional information on storage specific to school-based distribution. It includes a country example there from Tanzania, as well as links to several resources. So this is just a sort of a snapshot to show what other parts of the toolkit will look like as well. And then there's also a bar on the right-hand side where you can easily move between sections as well if you're looking for something specific and not finding it on the page that you're on. And with that, I will hand over to Steve in Tropical Health to share more on the adaptable tools. Steve, over to you.
Super, thanks, Mary, and hi everyone. Lovely to see everyone on the call this afternoon. And pick your time zone. So Mary's introduced the toolkit broadly, and one of the things that we wanted to do in revising the guidance that is available through AMP is to expand a library of adaptable tools that programs and partners can download and adapt to their setting. So we've maintained the country resources and the country examples that are on the current continuousdistribution.org site. But we've put more focus on adaptable tools for this revised version. And these are Word and Excel files that have guidance and instructions or are pre-filled with some example inputs that can support the planning and the implementation steps for school-based distribution. The tools are available in English, French, and Portuguese. And going back to our screen grabs, since the site isn't quite live yet, in the bottom left of the screen, you can see there's a specific tab or a specific window for adaptable tools under each step. So the step on the screen here is step number 4, planning. Below that, you can actually see the tab for the country examples that are provided related to this step as well, where we have updated country resources from Ghana, Tanzania, and Zambia. On the right-hand side, there's just an example of the risk assessment and mitigation plan template, which is provided in Excel. And this is a nice example of one of the adaptable tools that has been pre-populated with from risks that countries and partners face when planning and implementing school-based distribution. And this is included as a starting point for discussion amongst country teams when working through planning for SBD. So to date, we've developed 13 priority tools. And if you have experience supporting planning and implementation of mass campaigns, then some or all of the names on the screen here are clear to you. We've focused our inputs and our energies on tools that are relevant to the planning stage, which is why you'll see in step 4 planning, we've got five tools, the bulk of the adaptable tools there. And this is so that we can support programs in the design and planning of what is possibly going to be a new channel should programs decide to explore and adopt school-based distribution. So what are those adaptable tools for the planning stage? We have some generic terms of reference, which can be used as a jumping off point to help define roles and responsibilities between different members of staff and departments, particularly important for school-based distribution, considering the close engagement and collaboration required between the Ministry of Education and the Ministry of Health through the Malaria Programme. We have a plan of action. This is really, I think, the heart of the planning stage. It defines a document, a Word document that defines the SBD strategy and operational approach. And we'll look at that in a little bit more detail in a moment. And then we've also prepared timelines, checklists and guidance on planning and budgeting, and the risk assessment and mitigation plan, as we've just saw on the previous slide. Some of these other adaptable tools have been developed by updating existing country resources and adapting them so that they are generic and are more easily then adaptable by other people using the tools. And I think the supervision checklists and the routine monitoring forms that are available are nice examples of that. And we thank Ketty and Zambia for sharing their versions and allowing us to adapt them for the toolkit. Those documents are available in Word format at the moment, which isn't really in line with a digitalization, but the expectation is that they would be a good starting point to design digital capture forms and screens when countries pick them up and move forwards. Now, this is our initial thinking of what's most useful and what's likely to be most useful for programs. But as you all engage with the SBD toolkit, we're very interested to gather feedback on additional adaptable resources that we could collaborate on and make publicly available so that we continue to expand the toolkit. We'll jump a little bit more concretely about one of these tools. On the left-hand side of the screen is the content page. Word documents make it super exciting. The section headings in the plan of action are in red, and you might be able to see on the screen some text in blue at the top, which provides some brief instructions to the user on how to engage with the tool. The main sections for which content needs to be populated describes the introduction and the purpose of the plan, the country context, policies, lessons learned from distributions that have happened to date, and descriptions of the coordination structure and the supervision structure within the country. But then really the core of the work is, the core of the plan is the Section 8 SBD strategy, where you can see for each of the steps in the toolkit, there is a subsection with guidance on how to consider and document the details around how SBD will be implemented. So thinking first about macro and micro quantification, the approach to waste management, planning, logistics, personnel training, implementation, SBC, and ME. And these are also with the toolkit steps. People are referred back to the toolkit for additional resources and guidance, which can be referenced in the plan of action. So on the right-hand side of the screen is a screen grab of what Section 8D looks like. This is the section that deals with logistics and supply chain management. And really, we are trying to focus on the most important content and most important decisions that need to be documented in order to have a common understanding amongst all stakeholders, including funders, for the design and implementation of the channel. So the idea of the plan of action is that it doesn't end up being 200 pages of very dense text, but it's really drilling down on the most important decisions and the most important elements of each of those channel strategy decisions. So here you can see there are 4 bullet points towards the top. They're asking the team to briefly describe levels of the supply chain or briefly describe the personnel who will be involved. And then lower down, there is a list of considerations and elements that could be included in a logistics and supply chain plan of action, which would be annexed to this document. I'd say that amongst the tools we've developed so far, the plan of action has the most guidance to users on how to use and adapt the resource, as it covers the widest scope and is really instrumental in getting everyone on the same page about the channel. The other tools have fewer instructions, but we hope are still straightforward straight out or straight on being downloaded from the website. So happy to talk more about tools in the Q&A. For the top, I'll pass back to Mary to introduce some work that we're also doing around routine distribution channel optimization and guidance to that end.
Great. Thanks so much, Steve. And yeah, really delighted to be able to talk about ITN distribution through routine health services, which will be the next section of the continuous distribution toolkit that is already in development. It will look quite different from the SBD toolkit in that it will still follow the operational domains, but will be less of a step-by-step guide. We just felt that as most countries have been implementing ITN distribution through ANC, EPI, and other health services for many years. And there are quite specific global and country guidelines already in place. That what might be more helpful is looking at the key recommendations to ensure that this channel is most robustly used. And I'll talk through a little bit of our understanding of some of the key gaps in that area. But before moving to the next slide, would say that while we are in this space of thinking outside the box, looking at broad innovations that we can bring to most cost-effectively optimize health impact and save lives with shrinking resources and shrinking numbers of nets. We want to embrace and keep that innovation front and center. At the same time, we don't want to lose our fundamentals and the essential role that ITN distribution through routine health services plays and should continue to play across the board in ensuring access for pregnant women and young children. So with that, we can go to the next slide. Great. So looking at routine distribution, we want to, we understand that, optimally deploying in the current context will require some, while maintaining the fundamental channel, will require looking at diversified and potentially lower coverage approaches that are, tailored for population demographics, malaria transmission, and insecticide resistance profiles. So reinforcing ITN distribution through routine ANC and EPI services through operational reinforcement of those channels, we hope to reach an even greater proportion of pregnant women and young children, and recognizing that this aligns with the global WHO guiding principles for prioritizing interventions in the context of resource constraints. Next slide. And it's also, we want to, again, reiterate that delivering ITNs through routine health services is a very essential and effective priority. However, as we all know, there are some challenges and there are some gaps, almost by force of it being the channel that's been around and that has been implemented. Sometimes it can get a bit lost in the shuffle as well, especially after so much effort in implementing large campaigns and other types of distribution. It can sometimes feel a bit orphaned in terms of even the number of nets that are delivered through it, as well as some of the operational reinforcements. And a really great presentation that was presented by the UNDP team at the annual meeting meeting showed a review of 9 Global Fund grants with malaria activities that UNDP managed over the last couple of years. And it showed, widely varying performance from, sort of 15% to 120% in terms of achievement of the specific indicators for those Global Fund portfolios. And with most programs underachieving on targets set prior to some dedicated analysis and work between national malaria programs and the Global Fund and UNDP teams, in which through the course of one semester, 6 months to a year of dedicated interventions, they were able to see quite a very nice jump to be on target or above target in nearly all of those 8 countries and 1 regional program. We also have Janie Miller's paper from 2022, working with many of you and with national programs, which looked specifically at ITN routine distribution in 7 countries, and also noted wide variability in ITN issuing rates, 31 to 93% via ANC services and 39 to 92% for immunization services. So wide variability in how well we're reaching pregnant women and children under 1. Next slide. So therefore, we as a group will continue working with all of you on how we can reinforce learning from the UNDP experiences, looking at some PMI vector link process assessments and other assessments which have been done by other partners and by national programs to really look at those operational domains. And in many cases, having done 4 of those assessments, and Steve and I worked on a nice protocol for that we're happy to share at a later time, to sort of unpack what some of those operational challenges are. Many of them are fairly, I don't want to say simple fixes because nothing is simple, but fairly straightforward approaches that can really reinforce the issuing rates and the proportion of pregnant women and children under 1 receiving their net as designed. So one of the I won't go through all of these, but for example, one thing we'd like to do is look at those existing assessment tools and find sort of no-cost, lighter touch ways in which they can be done. They weren't very expensive, but we did do them in a sort of qualitative research way when they were implemented. So very happy to to take those protocols and look at ways in which we can lighten those and really look at ongoing conversations with between the national program and regional district health facility community teams to still bring back that information on where those tweaks and adjustments may be needed. One of the key steps is in the planning stage. Often there are national guidelines for routine distribution. In many cases, when I was doing the assessments, we couldn't actually put our hands on a copy of the guidelines until right at the end of the mission or after I was home. So someone has them somewhere. They are usually on a laptop. But when we would go out then to meet with health facility in charges and other people, they were aware, they had a general sense, but the specific guidance was often lost. And what that would lead to, for example, was when another program came in for performance-based financing, for example, they knew that they wanted to give to pregnant women, but to meet their PBF ANC4 target, they would say, well, why don't we just wait until ANC4, and then as a reward for the woman coming in for her 4 antenatal visits, we will give her a net. And, for obvious reasons, we don't want to wait to cover the woman during her pregnancy. So, having the instructions available. There's often confusion as well about if, there's an allowance to give to children under 1, which in some cases leads to lower coverage through EPI channels. So just clarifying and having simple job aids or reminders or note circulaire, things that can go out can really be instrumental in increasing the access through routine channels. On the logistics and supply side, it's no surprise that ensuring the last mile transport is key. In a lot of cases, ITNs are available in district warehouses, but not necessarily available at the health facility. Because ITNs are bulky and they're managed outside of the pharmaceutical chain often, and because they are free, they're sort of set apart from other improvements in overall supply and logistics channels. They can kind of get stuck right before they get to the health facility. And in a lot of cases, facility in charges proactively will spend their own money to do that transportation, but that's not always feasible. And in some cases, the requisition process isn't clear. So, nice systems are in place, but there were a lot of conversations of saying, well, the last time we had nets was 14 months ago or 18 months ago. So just ensuring that the nets are getting to the health facility is one of the fundamental challenges that came up across the assessments that I was involved in. And then on the communication and advocacy side, one of the points that the UNDP team raised at the annual meeting was also ensuring that health system strengthening component, making sure that we're boosting ANC and immunization attendance and services overall. And Steve will talk about some of the innovations as well on advanced strategies to ensure that we're reaching hard to reach areas as well. So I'll stop there and turn it over to Steve. But there's a lot more that we can unpack here and lots of long, lengthy assessment reports and things if folks are interested at any point to dive more deeply on that. That's always a great conversation. So Steve, over to you.
Thanks, Mary. And I've got my eye on the clock. I don't want to not leave time for Q&A before we move on to the second presentation in the webinar. So let me say, Mary's done a great job there describing the needs to reinforce the current ITN routine distribution channels to overcome what are common challenges seen in many settings. At the same time, programs and partners should, particularly in the current funding context, be exploring adaptations to standard strategies to maximize the effectiveness of routine channels. And there are several options for modified designs. I'm going to walk through a couple of examples to maybe get us all thinking, and we can pick those up in 10 minutes of Q&A that hopefully we'll have. One simple modification to consider would be the issuing of more than one ITN to each pregnant woman attending their first ANC visit or to children attending their eligible immunization visit. This is an example of adapting the channel's allocation strategy, and I'm sure that many others could be thought up by those of us on this call. We can also consider how routine channels target populations. So programs may consider expanding the eligibility criteria associated with EPI distribution, for example, still allocating one net per contact point, but children could be eligible to receive a net at their first measles vaccination, and then perhaps also during their last malaria vaccination. And that's a strategy that could perhaps be useful in settings where ITN lifespan is known to be fairly low, well under 2 years, as the gap between those first measles and last vaccine visits could fit nicely into that sort of timescale. In a second example, if resources are severely constrained, programs may need to consider geographic targeting to focus on areas with the highest or high and moderate burden and transmission potential. Adaptations could also be considered in terms of the distribution channels that are falling under this umbrella of routine distribution. If they are not already considered, ITNs should be considered part of the package of services offered by health facility outreach teams, also known as the stratégie avancée. This would help ensure that nets like the EPI and ANC services that are part of outreach reach populations that have poorer access to health facilities. Or programs could consider issuing one or more ITNs to severe malaria cases when they are discharged from a facility. As I say, these are just some examples of what could be possible. And I think it's important, as Mary hinted, also to bring a creative mindset to the process of problem solving and for programs and partners to consider, of course, what's possible in their context. However, it is vital, it is a balance, right? A trade-off, a balance. It's vital to consider also the current performance of the routine distribution channel and to do that before thinking about expanding the strategy and expanding the potential output. Many of the challenges that Mary described are likely to be compounded by some of these adaptations because they will naturally lead to a higher throughput of nets through these routine channels. So it's really important to first build and maintain a strong foundation for the routine channel before looking to these adaptations to help support ITN access in the current funding context. While these suggestions focused on the design of the routine distribution strategy, they also need to be considered in the context of the country's proposed channel mix. For example, what would a change in the ITN allocation strategy at ANC mean for estimated ITN access amongst target populations? And what would the implication be for other channels in a country's channel mix? And I think this really brings us back to the start of the presentation and Ketty's discussion about the forthcoming channel selection guidance from AMP. Because the decisions on the channel mix and then a strategy within that channel need to be taken holistically to maximize the effectiveness and the efficiency of all of the channels that are being used and to optimize ITN access amongst your target population. And really an aim of the channel selection guidance and the revamped continuous distribution toolkit when taken together is to support programs in this decision-making process. With these resources, AMP partnership and particularly the AMP CD working group when thinking about continuous distribution are here to support programs in this decision-making process. So with that, I'd like to thank my co-presenters who've come before me and we will move on to a period of Q&A. And let me see if Prince is on the line. Prince, are you with us?
Yes, I am. Thanks so much, Steve. Thanks so much, Mary and Katie. So we do have some questions in the chat box that I think I would want to go into those to start with. I know Mary started addressing some of them. David, you asked the question of whether the guidance includes guidance on MP-EPI collaboration as a way of improving ITN distribution coverage. That's a good suggestion. I think it's so beneficial that it's not just increasing ITN distribution coverage, but it also increases EPI coverage as well. Maybe, Mary, if I may ask, do you have anything to add? Do we have guidance in there?
Yeah, thanks so much, Prince, and thanks, David. I think that's an excellent suggestion. And I think, interestingly, it didn't come up as a gap in our, at least in the 4 vector link assessments. But perhaps that's because it's not front and center on people's radar to to have that reinforced collaboration. So I think that's an excellent suggestion, and I'm actually going to copy and paste that as we're in the process of developing those recommendations now. So any and all inputs are really helpful. So thanks, David, and warm hellos.
Okay, and thanks, Mary. And PL Carnaval, you do ask, at what point do we know, or at what point do we need new ITNs, and where and when to deploy them? Steve, you do want to address this?
Is that Pierre's question, Prince?
Yes.
Yes. Well, I think ideally we have distribution systems that are supported by robust performance monitoring, routine performance monitoring systems, or if those monitoring systems aren't there, we have some intermittent evaluation or other performance system that allows us to assess the performance of those channels. The channel selection guidance document includes a focus on this before moving into the discussion of channels, and provides some guidance on the types of metrics to be assessed and the sorts of questions that programs should be asking when assessing how well a channel is performing. Because we know that even a country that is doing a good job delivering ITNs every 3 years through mass campaign, and perhaps has a robust ANC and EPI distribution, is pretty unlikely to achieve their ITN coverage targets. And certainly, in the months following the mass campaign, access fairly quickly declines. So targets are not being met. Let's stop and assess the performance of the channels and think about, both in the particular funding context we're in now, what are our priorities for targeting nets, and what targets do we want to set ourselves associated with those populations, and then take that information into a decision-making process. That some of this material in the toolkit that we've described and the guidance documents can help manage that discussion, to assess which channel options are going to be best in a particular context to achieve that target and to meet those populations.
All right.
Maybe, Prince, I'll just say that the guidance is really to frame a conversation. We have a lot of guidance and a lot of tools and materials to help frame conversations, but ultimately you don't start at point A and at the end of the guidance and the materials you get the answer that says you should be doing X or you should not be doing Y. It's really holistic and iterative. Let's evaluate how well we're doing now, think about what potential we could get from these channels, and see whether that is going to help us get closer to or fully meet our coverage needs. And if not, well, if yes, implement, and if not, back to the start and sort of tweak and iterate until we are as close as possible to the optimum coverage that we're all looking for.
Okay. Thanks so much, Steve. I think we have just 2 minutes, and so we will continue to address the questions that have been posted in the chat box. But any other burning question? I know there are several questions there. We will do our best to address them. Any question from the team?
Prince, we had a nice question from Charles to the hosts and panelists. So thanks, Charles Mwalimu, for the question, and I think it's really critical. So I'm just jumping in. I hope that's okay. And his question is: in areas with targeted mass campaign being implemented, and given the resource constraint, the practical question is it still justifiable to also be delivering through another channel, through ANC and EPI? And echoing the guidance from WHO in the global guidelines for malaria, as well as the recent guidance on prioritization of interventions, a resounding yes. It is critical to continue distribution through routine channels, because we want to make sure that we are always providing an opportunity for pregnant women to receive an ITN as early in the pregnancy as possible, as well as for young children around that critical age when they're getting usually their first measles vaccination, that they can also be covered when they may be moving out of the sleeping area shared with the mother. So critical to do that, recognizing that there are resource constraints. So each country team will need to plan, but the guidance echoes time and again that it is fundamental that distribution through routine ANC and EPI services is the essential priority, and other things can come in around that. Obviously, that channel will not achieve the access that you need overall, but because of reaching the critical vulnerable populations. Over.
All
Great.
right, thanks, Mary. So please keep sending in your questions and we will do well to answer them in the chat box. Over.
Perfect, thank you. So we just have a recording here from my colleague Sophia Kaufman from Chai. It's about 17 minutes long, so I'll play that now, and it should take us almost right up to the hour. But please keep posting any Q&As, and any questions for Sophia will be passed on following the webinar. We'll be sharing her email, so you can pass some questions on there.
Hello, everyone. My name is Sophia Kaufman, and very happy to be speaking with you today. Sorry that I couldn't be presenting in person, but hopefully if you have any questions, my email will be in the chat, and you can email me or put messages in the chat for questions. I am a senior associate in the Vector Control Operations and Country Support area with and I'm on the Global Malaria and Vector Control team. I am originally from the US, from West Virginia, but I'm based in Kigali, Rwanda right now. And I've been working on continuous distribution tracking and understandings for the last couple months now. And looking at some of the different countries that we're working with and really trying to understand what types of continuous distribution is happening and where we're going in the future. So today I'm going to be presenting on continuous distribution tracking and next steps. So first, continuous distribution is emerging as sort of a lifeline in this evolving vector control landscape. And what we've seen as with shrinking budgets and changing funding landscapes, countries are having to make strategic use of continuous distribution channels to protect the most at risk. And as resources for ITN campaigns are anticipated to decline, CD can offer a pathway to sustain coverage and reach key populations. And many countries are already adjusting their approaches and facing difficult trade-offs as they're trying to move toward more targeted and year-round distribution strategies. So as these conversations have started to take place, I started to have a lot of questions around continuous distribution. And this is sort of a little background of what got me into this type of work and working on a tracker. But a lot of questions started to emerge. So people were asking what countries had current continuous distribution policies and plans. Different teams were interested in understanding what countries were implementing continuous distribution and to what extent, as well as what challenges and gaps were occurring tied to the new funding changes. And as I started to have a lot of these conversations internally and with partners, I started to do a little bit more digging into it and looking for information myself to really answer these questions. And what I found is that in tracking continuous distribution policies and implementation, it was difficult to find up-to-date and consolidated information. And there were really few shared resources that could bring data together from different sources in a sort of cross-collaborative way. And there were really a lot of questions around continuous distribution. So this is what really sort of started me working on this informal tracker. And I had conversations with those that have presented before me from the Vector Control Working Group, and really had discussions around what types of resources other people were working on and how this might be able to be useful for different audiences. And so this is a sort of snapshot, a little teaser of what I started working on. It's what I'm calling a continuous distribution tracker. But it's really bringing together country level implementation data on continuous distribution, the channels that are being used, and painting sort of a picture with these detailed data points to help us understand better the landscape and bring that information in a more easy and forward way. And so the thinking is that this might be able to be useful for different partners, or it could be an opportunity for collaboration. It's still very much in the early stages of the thinking, but I want to really open it up if this is something that can be useful to others, to have discussions on how it could be used and for what. So right at this point, the majority of the information in this tracker is from MOPS and publicly available data. Some of it has also been updated from insights from CHI country team members and country NMCPs. What you're seeing now in this view is just a snapshot, and the majority of information is filled out for a few of different CHI countries for internal reasons, but I'm very open to expanding this to other countries, especially if you express interest and see that there may be other ways that it can be used or expanded to other contexts. This was really sort of coming together. I started to hear more conversations and questions around different CD information. So just to that we have, in left, we have 3 countries that have continuous distribution. I've noted if they have a CD plan or not. And then when they do have a continuous distribution plan, outlined what continuous distribution channels are specifically being used. So you can see that for some countries, they are using ANC and EPI. Others, like Cambodia, in the past have targeted migrant populations. Sierra Leone in the past may have targeted primary schools in addition to ANC and EPI. I've outlined who the funder is for the CD channel work, as well as a budget that was outlined in the MOPS. This is if there was a budget that was previously budgeted. That doesn't necessarily mean it's what was actually used or what is currently in use, but what type of delineation between money for distribution and procurement, or ANC and EPI. And then in the coverage area, what areas those channels were supposed to cover for the planned years, how long that coverage was supposed to last. Orange represents something that's been in the past and is now done, and yellow is something that's ongoing into the following years. In the more information column, I've worked to outline a little bit more about these different details through reading the MOPS specifically for each country. So that might be specifics on how that budget is allocated down at a more community level. It might be around areas within detailed coverage areas that have different funders or different aspects covered financially by different donors. It also might talk a little bit about what the breakdown between types of nets are that are being used in different coverage areas. And so this is a second shot of this Excel spreadsheet that I've been working on. That sort of outlines what funding gaps were from MOPS first. So these were continuous distribution funding gaps that were predicted based on the 2024 MOPS. So that might have been a certain number of ANC nets or EPI nets that would be missing for the following year, or a plan of procurement environment that was initially detailed that they saw would have a gap in supply chain or logistics, and maybe how many nets are still needed based on that plan. But then it became very clear that these funding gaps were not necessarily up to date, given that there's so many changes that we've experienced in the last couple months. So I started to have different conversations to try and see what USG funding gaps were looking like as they pertain to continuous distribution. And so I started to try and get information around the number of nets that may actually be missing, and the status of the CD programs in these different countries. I've color coded them to sort of highlight different urgencies that might exist in the countries. But really in this column, we found that in many cases, what was originally planned is no longer possible with new funding, or there may be new bottlenecks and challenges. It might be that nets are ordered and delivered but stuck at port, or that certain regions that had certain funders no longer have any nets planned to be delivered at all. And so I've started to make different updates and comments based on the conversations I've been having with different focal people in different countries to really try and get the most up-to-date picture of what's happening for continuous distribution in each country. And like hoping that with this information being in one place, when people start to reach out to me with different questions around what's happening in the current landscape or what is possible in new countries, that this can be sort of an aid to facilitate those conversations. So tracking what matters across CD implementation allows us to connect the dots and uncover some critical insights. We know that there's a lot of knowledge gaps, and we're trying to fill this in any way possible. So I don't know if this could be useful for others, but I wanted to try and start to have this conversation in case it could be. And if you're interested in collaborating on this or see ways that you think I could change the direction or expand it, I'm definitely open to having that feedback and working with others. This tracker, the hope is that it could help guide some evaluation of channel performances across different country contexts and help us identify current challenges in order to strengthen continuous distribution. And a lot of different CHI partners and country focal points have come to me, like Haiti, for example, and said, you know, we want to have discussions around which channels might best extend ITN coverage given our context and what that could look like and what are the potential implications and factors to consider when thinking about our distribution methods. Maybe that's existing resources, maybe it's data coverage or supply chain. And then the thinking is that we can look at these different examples and lessons learned from these countries, as well as the tools that were presented prior to my talk right now, and together make some informed decisions and be able to provide a better support. So these are a lot of the questions that we're really trying to answer. So what past national strategies have been created and implemented for continuous distribution? What new changes or challenges are occurring? And what countries are really in need of more support? Where are there urgent gaps? And so there's a lot of different questions within those that we can ask around what channels are being used and what type of ITN shortages exist. And this type of tracker is hopefully bringing some of that information together. And so in addition to the tracker, something that I've been working on is a qualitative analysis in Burkina Faso and Cameroon in order to uncover and better understand gaps and challenges in routine distribution. And together with my CHI colleagues, local NMCPs and government officials, we've been really asking certain questions around how effective and cost efficient is routine distribution for ANC and EPI in these settings. And we really want to understand what current structures of routine distribution exist, what is the actual reality on the ground, and does it match the guidelines and the ideal situations. And so we've been asking questions like, what are the differences that might exist between different conflict-afflicted areas? What mechanisms are in place to target vulnerable populations? And what contextual factors might influence routine distribution effectiveness? And we're working to identify and understand some of these gaps around the existing routine distribution systems. And these gaps can be in supply chain around challenges with transportation costs. They can be in financing, implementation, and even data systems, and how different the on-the-ground reality is with training and community health workers or health worker staff. And the goal is, with understanding these gaps, we can estimate the cost benefit analysis a little bit better and make recommendations that are targeted to improve routine distribution based on what we're seeing, and as well as the conversations that we're having with the different in-country partners. So we'll be wrapping up this scoping analysis in Q3 and Q4, and have some deep dives into Burkina Faso and Cameroon with more information, hopefully that can be shared with different national and subnational partners, as well as with you all as well. And so we're still sort of in these preliminary phases, but this is one of the things that we're looking at. So while we don't have the results, the hope is that with this type of work, we can start to answer questions through collaborative information gathering, and build more support that's needed for the future development of continuous distribution. And so what we're really trying to do is we're looking at aspects of tracking and how country continuous distribution implementation plans are performed, evaluation, looking at what worked and what didn't, support for how we can use these different case studies to guide other countries, and then future applications and how countries can manage transitions from mass campaigns to routine systems. And we're really looking for opportunities for these different continuous channels that also includes private sector ITN distribution and community health workers, as these are other channels that will be particularly important for the GC7 and future funding cycles. And so for each of the channels, we're really trying to gather information in the current landscape and also understand from past case studies what is working and what's recommended. And this information, together with what the others have presented today, the tools and guidelines that have been shared, hopefully can be used collaboratively to make informed decisions. So that's all for me today. Please do look for my email if you have thoughts or questions about what I've presented. I'm very open to having these discussions and answering questions, and hopeful that this can be used in the future widely and collaboratively. So thank you very much, and look forward to talking to you all more. Thank you.
Great, fantastic. So many thanks to Sophia for that presentation. She's really sorry that she couldn't join us live today. I'm really sorry that we won't have time for Q&A, but please, I'll post all of the email addresses of all of our speakers in the follow-up email, so you can follow up with the speakers directly. I'd like to thank all our speakers, Mary, Steve, Ketty, and Prince, and Sophia. Thank you for presenting the amplifying existing tools that are available. I think this is going to be more and more important as we potentially start relying more and more on continuous distribution channels. And we'll be back, Task Team 2 will be back later on in the summer with another webinar, this time that will be on post-market data collection. So look forward to seeing you all then. Thank you to Joanna for helping us organize all of this webinar, and thanks to our interpreters too. And thank you everyone for your interaction and attending the webinar today. So thank you very much.